one is that cats aren't going to like the diet. That bothers me a lot. Why? Because these cats are already coming to us not feeling well, already not eating very much. And I think our tendency, again, in wanting to help those cats is here, take this treatment, which has been shown to work, but it's a switch immediately. And we forget that these kidney cats are actually GI patients initially.
I love the way you phrase that.
Sorry for saying sorry. Media presents the Purr Podcast, the best podcast for feline medicine and surgery with tips, tricks, and updates for the entire veterinary healthcare team. If you're dying to know more about cats, keep on listening. Here are your hosts, Dr. Susan Little, famous cat vet and textbook author, and Dr. Jolle Kirpenstein, talented surgeon and social media geek.
Hello, this is Serge Chaloub, and welcome to the Purr Podcast. I am actually your invited guest, but I am surrounded by my hosts.
Yes, and this is number 2, by the way, which he forgot to say, but that's okay.
That's okay, because he's a really good intro guy.
I know, he is a great intro guy. And this is Dr. Jolle Kirpenstein.
And I'm Dr. Susan Little, and we're so thrilled that you're with us, Serge. Yeah, we're going to get you to announce more of these.
And this is the Purr Podcast.
Thank you so much.
So if we look at the full population of cats, how many cats will get renal disease?
Ooh.
Well, I mean, there's a lot of statistics out there. I've read one that cats age 15 and above, 80% of them will develop some kind of renal dysfunction. 9 and above, 30%. So it's
common.
So, but and so for me, as an illogical surgeon, I would think, if my cat gets to 9. I need to start thinking diet change.
I actually recommend at the age of 8 to start screening that geriatric cat for early kidney disease, proteinuria, hypertension, and potentially other associated things. I don't know what your thoughts are.
Yeah, I think we start to change our approach to cats around like 7 or 8. I think it's a reasonable age to say, okay, you're in a different life stage now. We need to up our game in terms, not just renal disease, obviously, like hyperthyroidism, whatever. Disease. And then we need life stage appropriate diet, right?
Agreed.
And so that often means moving to a geriatric diet, which can function kind of as an early or pre-renal, whatever you want to call it, right?
Yep.
Type of diet for those guys.
Agreed.
So, so I think that's a really reasonable route to go.
And I think it's also you can explain it easier to the owner why you do this because you have the statistics behind it.
Right.
So it makes a lot of sense to and that goes back to the re-education of veterinarians in general to think about diet as a therapeutic option.
Yep.
And renal is the place where you should think about that.
Absolutely.
And still there's a lot of people that have they don't trust it completely. The cat doesn't show any clinical signs, so let's wait until he gets really sick, and then often it's too late.
Right. And and in going off of that, when they say the cats aren't really sick, I think that's where that weight loss paper really showed that they that cat that lost 9% of its body weight, that's a clinical sign. That means there is inflammation, there are changes going on in the body. We shouldn't ignore it.
Yeah, that's not benign. People tend to shrug off these like small gradual weight changes, right?
But we talked about that. So every time a cat comes in your clinic, you weigh it, and if you see a trend, look at the trend and do something about it. So,
exactly.
Yeah.
And it's not that an obese cat suddenly exercises.
No.
And taking away is free.
Yes.
Yeah. So let's talk a little bit more about renal diets because we've got very solid evidence that they are very helpful for this disease. But as you know, what puts some people off or what worries some people about them is the protein restriction.
Yes.
Right. So let's talk a little bit about that and why are people are afraid of that.
Yes,
right?
absolutely.
Yeah.
So people are afraid of that. I think that's probably misconception. They don't really understand that it's not truly a huge protein restriction. It's more a modification of what amino acids are going to be in there. And more importantly, phosphorus, right?
Yeah.
I mean, we forget about phosphorus.
That's the key.
And research is coming out and showing that, hey, phosphorus is potentially one of the killers.
Guy.
Yeah, absolutely. Yeah. I mean, we can talk about those later, but there's a couple of papers that have come out that showed that, cats that develop chronic kidney disease may have, elevated FGF23, which is a sign of phosphorus dysregulation in advance of chronic kidney disease. So I think that's the huge misconception. The other one is that cats aren't going to like the diet. That bothers me a lot. Why? Because these cats are already coming to us not feeling well, already not eating very much. And I think our tendency, again, in wanting to help those cats is here, take this treatment, which has been shown to work, but it's a switch immediately. And we forget that these kidney cats are actually GI patients initially.
I love the way you phrase that.
That's good.
They're nauseous, they're vomiting, they don't feel good, they're dehydrated. We forget about all those things. I tend to wait on starting a renal diet for a couple weeks. Stimulate their appetite, give them sub-Q fluids, make them feel better.
Set them up for success.
Exactly. And I actually wait to treat hyperphosphatemia. I start them on the diet, one thing at a time, recheck the phosphorus. If it's not in the guidelines I like to use, which is the IRIS guidelines, then I treat that, then et cetera, one thing at a time over multiple weeks.
Yeah.
I think people also are not understanding that it's not about the amount of protein, but the quality too.
The quality. Exactly. The amino acids. Exactly. So, exactly.
Yeah. And
the nutrient.
Again, correct me if I'm wrong, but I think some of the studies of chronic kidney disease cats on renal diets have looked at lean body mass.
Yes.
And they don't lose lean body mass.
No. That landmark study by Dr. Ross that she published, 2006 study that showed, 0 uremic crises for the cats that were on the renal diets. They all maintain lean body mass. It's an interesting line that no one tends to talk about it. Exactly. Yeah. So I think the key thing is cats have to eat.
They have to eat
their caloric intake.
Yes.
But for them to do that, we all know cats are aliens from outer space. They are. They're very picky. They're very finicky. If you switch something immediately, they're going to look at you and it's like, no way.
No way.
No way.
Yeah.
So why would we do that to a cat that's already not feeling well?
Although I do think that all companies that produce quality renal diets really have looked at the palatability of these diets.
Absolutely.
And
especially these days.
Tremendously. And you see that's a huge difference.
Yeah, but I think it's the approach to the cat, right? Like a diet change is never an emergency.
No.
I can't easily think
like that.
it's not an you're welcome. Yeah, but please. Yeah. No, but it isn't really, is it? I can't think of a situation where it's an emergency to make a diet change.
Exactly.
So, I love the fact that, that you probably talk to owners that we're going to do this.
Yeah.
But we want to treat, and I love the way you say they're a GI patient first, right? So, because we've got some great treatments for that, right? We can use mirtazapine, we can use meropitant, we can get some fluids into them.
You probably should change it already before that. I mean, we talked about that too. I mean, when they have these severe clinical signs already, you're way ahead already. I mean,
but some of them come in kind of acute on chronic, scenarios, right? True. And you got to get them through their acute scenario, right?
Of and then often people advise not to change the diet while the cat is in the clinic.
Yeah,
exactly.
I'm a big fan of that.
I mean, food aversion.
Huge
cats are the poster children for that.
They
right?
are.
So,
They'll go home and say, "That's it. I'm never going to eat that diet ever again."
Serge was a nice guy, but
and I'll never talk to you again.
Never again.
I don't care. I'm never
Finger number 2 gone.
Yeah. So patience. Cats just need time.
Absolutely.
They need patience. Yeah, I love
they need
that.
a different language.
They
really
need
do.
A different language. Yeah. So there's one class of drugs that traditionally we've been using a lot in chronic kidney disease patients. It's kind of falling out of favor, right? At least it is for me, and I suspect it is for you too. And that's the gastric acid suppressant drugs.
Absolutely.
Right?
So drugs like famotidine, omeprazole, very interesting things. I mean, there was a landmark study that showed that cats with chronic kidney disease actually don't develop GI ulceration, which was a huge surprise, and that's compared to dogs and humans. And the new ACVIM consensus guidelines on the use of these drugs specifically discourages the use in cats.
And we did a podcast that came out a little earlier this year with Katie Tolbert talking about those.
Yeah, fantastic.
So it's just a really good point to underline.
Yes. And to repeat, because people don't always listen. So again,
if you have a cat that's not eating, we always tend to jump to famotidine.
We do.
And why not jump to save your finger, use something like mirtazapine, which has been shown, in multiple studies, one by being Dr. Quimby, that showed that it stimulates their appetite and makes them less nauseous.
Yeah, and they'll gain weight.
Exactly.
Yeah.
And
it
we
has
can
an
say
antiemetic
that. We can see that.
Yeah, that's true.
Absolutely.
So they're very lucky in the U.S. because they have a licensed transdermal mirtazapine. By Mirataz, right? Mirataz.
Yeah.
Yeah, so we have to cross our fingers and hope we'll get it in
We've actually have been able to get it but compounded.
Yes. Right? Yeah, which is kind of like a plan B, obviously.
Right, exactly.
Right? Yeah.
But in the US, they have a new appetite stimulant as well, the ghrelin receptor.
Entice.
Entice, I think is what it is.
Entice.
Yeah.
Yes. I think it's licensed in dogs.
That's right.
Have you guys tried it in cats at all?
We can't get it.
No. I know there is at least one paper in the literature using Entice in chronic kidney disease cats. I think there's one paper.
Correct, there is.
Right?
Yep.
Yeah. So
and showed a benefit.
Yeah, so they're that's a potential new pathway.
Right.
I didn't realize there was so much difficulty from drugs that are FDA approved to get into Canada. You have a whole new different system then, I guess. Yeah.
I think it's vice versa, right? Because for instance, meloxicam, right, was initially approved in Canada, not in the US for many years. So I'm actually not too familiar with all that.
So there is, and I'm not an expert in this either. There is different licensing systems, and sometimes it's not necessarily that a drug that's got approval in the US can't get approval in Canada. Sometimes it's just not worth a company's while.
Right.
So Canada's a much smaller market. So sometimes it's the economics that prevents us from getting a drug, right? Because there's a cost-benefit analysis these guys go through.
Which makes sense.
So does Canada follow the European rules more commonly or the US rules?
You know,
or do they have
I don't know enough
different?
about our Veterinary Drugs Directorate is the government organization that takes care of that, but I would not presume to know what I don't know enough about that. So,
because both agencies put so much time and effort into this quality regulation, it would be kind of silly to start your own. But you know, that's my simple opinion. Yeah, but you know, Serge is right. Sometimes we have drugs in Canada, they don't have the US and vice versa.
Right.
It happens. So, but anyway, we cross our fingers for some of these other drugs that might help our chronic kidney disease patients.
For sure.
Yeah.
For sure.
So, you know, so that's important. And we know that drugs like mirtazapine are safe for chronic use in cats,
Correct.
you know, which is good to know.
Yep.
And even drugs like mirtazapine, which has that, you know, so this is a question I get all the time. The label says only, what is it, 5
2
days?
weeks or 5 days. That's it.
I think it's 5 days.
5 days. That's
I think it's 5 days.
Yeah.
Sometimes I get confused by countries because it depends on what country you're in, right? But it has a very short time.
Yep.
But it's okay.
Yep.
You know, you can use it for longer
Absolutely.
than that.
Study has shown us that as well. Exactly.
Yeah. So it's always important to recognize that the terms under which a drug gets licensed doesn't always mean, right, that we can't use it for a longer term. And if we've got a study in the literature that supports it, then we're good. Yeah.
Yep.
Yeah. So another thing I wanted to bring up is the issue of sub-Q fluids. And sort of the when and the how much and the how often. How do you feel about it? Because not a lot of data. So how do you feel about that?
No, there's actually no data. I think there's a very old paper that showed that giving sub-Q fluids could increase, I think GFR was like a paper from, you know, the 80s, I think. But you're right, there's no data. But I think it's a clinical decision. You know, cat comes in, it has stable chronic kidney disease and isn't clinically dehydrated, no signs of dehydration and blood work, likely doesn't need sub-Q fluids. You know, higher you get in the staging of virus, the likelier that they're going to need sub-Q fluids. And again, the key thing is not to try to drown them because you're not fixing anything. I think that's another misconception about fluids, is that the fluids fix the kidneys by lowering the creatinine. But again, all you're doing is taking care of the pre-renal component. So I would say use it only as needed. So maybe once they're diagnosed and they're feeling ill, that initial period, and then afterwards, only when the cat becomes clinically or subclinically with blood work evidence of dehydration, I would say to use it. You know, I don't know what your thoughts are, but often I'll start maybe every other day, you know, warm the fluids. You know, there's a lot of strategies on giving sub-Q fluids using LRS potentially, just so it doesn't sting. And, you know, and then if the cat needs it, giving it more. And I try never to go more than 80 to 100 mLs. I don't know about you.
Yeah, I think it's a good volume.
Yeah.
You know, beyond that, it's kind of uncomfortable. And if you really need more fluids than that, you shouldn't be getting them by the sub-Q route. Right?
LRS is potassium in it too.
It has a little bit. So we can add potassium. So that's sometimes a benefit, right? You can bump up the potassium amount for the hypokalemic cats. And I think it's often hard for owners to know. This is a question, you know, that we get when we're working with owners, because we'll often set them up with the fluids and they have it at home. And they're like, well, but how do I know, right, that it's time? So, you know, we try to talk them about things like, you know, their cat's attitude and their energy level and their appetite. Yeah. And we have them look at the litter box. They've got little tiny high, you know, dry, hard stools.
Idea.
Yeah. So that's often an easier way for owners to tell. As you know, in older cats, like skin tenting is not that reliable.
No, exactly.
You know,
I also think a lot of veterinarians will probably grab to sub-Q fluids because it's an easy therapy.
It's easy.
And it gives results, you know, visible results.
Yeah.
You give something and, you know, the cat feels better. And that's it.
Yeah, but it is a burden for the owner too. So it's not always easy to do. And so I also think it's important to note that there's no like right or wrong time to do it. It's not like every cat in stage 2.
Right.
You know, now for the rest of your life, you get sub-Q fluids like every second day. And I do hear a lot of that.
The renal aid kit.
There's your renal aid kit. I hear a lot of that. So I think we have to apply more individuality and more flexibility to that.
Agreed.
Yeah, and do it as needed.
And a lot of owners are scared of needles, right? I mean, I've had that. You know, your pet's going to need this. And if you don't have that dialogue, they don't necessarily tell you they're not comfortable with it.
No.
But, you know, I mean, it is certainly something, right? I mean, you know, pulling your cat's, you know, skin tent up and putting a needle in for some owners.
And it's a big needle.
It's a big needle.
And it's a little scary.
Yep.
So, you know, you probably like me and a lot of veterinarians, sometimes we have to be just pet owners too with our own pets at home, right?
For sure.
And so there you are with your cat in the bathroom sink, and it's on the shower curtain with a coat hanger, and so it gives you insight into what your clients are trying to do at home, right? To get it's not like they've got a little mini clinic in there and they got an IV stand, right? Yeah. Right? They're trying to corral their cat in a bathroom and hang it on the shower rod. So it's not necessarily that easy. No,
agreed.
Yeah, so I think we have to be thoughtful about that. Have you ever tried any of these like the implantable ports? Do you know what I'm talking about?
Yes, I actually have. Haven't had much success, and it not quite sure. It might actually be a surgeon's question. But if I recall, there were a lot of adhesions that would occur underneath, and the port would stop right.
Do you know what we're talking about? Those little buttons, yeah? Have you tried those in cats for anything?
I have, but once again, normally to give medications, not really to give fluids.
Right.
Gotcha. So, it's so easy to give sub-Q fluids to the cat. You don't really need the port for that.
And then there's those implantable tubes, the fenestrated tubes. I don't know if they're still around.
Oh, I don't know.
Yeah, there was just a type of implantable tube kit that was around for a while, designed
usually for pain management. So
I guess sort of like that theory, but they were designed and sold for sub-Q fluids. But again, I think cats are so good at like making fibrin and walling things off.
Yep.
Yeah. So and also like foreign body and cat.
Right.
Where does that lead? Right. Yeah. Exactly. So you want to be really careful about that. Right.
No,
speaking of oncology and and tumors.
Yes. Although I can't remember that we get a lot of soft tissue sarcomas referred that were caused by fluid administration.
I did have a cat that formed a sarcoma at a site of repeated sub-Q fluid administration.
Really?
Coincidence or not, who knows?
Yeah.
And it's a 1 out of a million, obviously, right? But I think if you're that predisposed cat, it might not take much. Yeah. So, but anyway, that's like one in a lifetime. So, please don't let
that's crazy.
Yeah. Don't take
any
that for
other
more than
therapeutics that we should think about.
Yeah. What else is key for these guys?
Well, I mean, I think phosphorus control is a big one.
Oh, yeah.
Again, where is the evidence for that? It's not, we know phosphorus is a problem in terms of the treatments. We do have some treatments that do work. There's no doubt. It's almost pick your drug, essentially. Aluminum hydroxide, calcium carbonate, et cetera, et cetera. Yeah, exactly.
Do you worry about calcium levels in the calcium carbonate guys?
I do. And if they're hypercalcemic to start with, I may not use calcium carbonate. If they already have calcium oxalate stones, especially if they're nephrolips, uretroliph cats, I try to avoid it when possible, and I'll go to aluminum hydroxide or lanthanum carbonate.
So you're able to get lanthanum.
And that's why I stopped myself. I haven't been able to get in years.
And
I was like, but no.
No, like me too. And maybe it is in other countries, but it's kind of unfortunate for us,
It worked great.
Yeah, it worked
expensive,
great.
But worked great.
Expensive, but worked great. So that leads me to another controversial topic, calcitriol.
Mm-hmm.
Yeah.
Well, it's controversial, which is interesting. We've been talking about phosphorus control, FGF23, yet the one study that looked at calcitriol for cats failed to show a significant effect on survival versus the dog study. Ooh, darn it. I said the D word.
That's okay.
Oh.
You're doing pretty good. You're in the top 5 though. You're okay.
Yeah.
Darn it.
You were there with Stan, and now you're dropping down.
Yeah, you're dropping
down a little bit.
Well, yeah. So compared to that other species group that we treat in the small animal world, there was a failed survival benefit. So I don't know. I have mixed feelings. I know some veterinarians go ahead and give it. Others don't. For me, it comes down to, okay, I'm going to prioritize the treatments that are going to make this cat feel better first, right? So the GI stuff we were talking about, the kidney diet, and phosphorus control where possible.
Potassium if you need it.
Exactly. Potassium, because we know potassium is going to make him feel bad if it's low.
Yeah.
Exactly.
Yeah. So I'm like you too, and it's a low priority for me.
Yep.
We only have one study in the literature. Maybe it was the wrong dose. Maybe it was the wrong interval. We don't know.
Small numbers.
Yep. But, speaking in that overall scheme of things, it's also another burden to the owner.
Mm-hmm.
It's another drug to give. Right? And it requires monitoring. And the drug is expensive, and the monitoring is expensive.
Exactly.
So it is a financial and a time burden for the owner, right? So I think we have to be really thoughtful about where we place that in our hierarchy.
Yep. Yeah. Agreed. 100%.
Yeah. I really like that you take a humane approach to treating these guys.
Or a feline approach.
Yeah, a humane feline approach, Because these are cats that are in the last quarter of their lifespan, right? People are often very bonded to them.
Yes.
Younger people that they may have had that pet all of their life that they can remember. Right. It's a huge moment in their lives. And I think as veterinarians, we have to be careful we don't come in and totally disrupt the bond, right?
Agreed, 100%.
Yeah. So, I'll often find that, if I have two patients, let's say that I might judge, pretty similar in their kidney disease, I might do a whole lot with this guy and a lot less with that guy because it's just what works.
100%.
Yeah.
And, coming back to phosphorus, that has been shown to show progression between two cats who have the same stage of chronic kidney disease.
Yeah.
So there's no doubt controlling phosphorus is important. And I think we're going to learn a lot more about that over the next couple of years.
Yeah.
And who knows, we may come back to calcitrio.
Yeah. So do you think we're going to get some earlier markers of disruption of that whole, now we talk about, what is it, renal disease?
That's right. Yeah, I do think so.
Do you think we'll get some maybe FGF23? Do you think we might start seeing that?
Yeah, I think so. I do think so. I'm not up to date on that literature, but I think it's going to come out as an early biomarker, and who knows what else we're going to be able to do.
Right, because it goes up before phosphorus goes up. Exactly. It's predictive, right?
Exactly. Yeah, and before easytemia.
Yeah.
And for those cats that have renal disease and hypertension.
Mm-hmm. Yeah. For cats with renal disease, thankfully, this is one of the rare times where we have a drug that's very effective, which is amlodipine. Mm-hmm. And it works quite well. And so that's less of a concern, which is good.
It is. And we have two drugs, although telmisartan isn't in Canada.
Exactly.
We don't have the hypertension formulation. Yep. But in the US and in the EU, it comes in a second higher strength formulation.
Right.
That is suitable for hypertension. So,
and is it still a liquid? I haven't seen it.
Still
which
liquid.
Is fantastic, right?
It's still liquid. It's a 10 milligram per mil liquid on the hypertension label.
Yeah.
Whereas we've had it in Canada for proteinuria for a long time at 4 milligrams per mil. So it's kind of hard to use it for hypertension.
Yeah, you'd finish the bottle much faster.
And what's the dose you use?
Oh, goodness, I don't know. I never remember doses.
Okay, we'll put it in the notes.
Yeah, well, who knows doses?
Thank you.
I do know that the way it's dosed for or licensed for hypertension in the U.S. is different from the way it's licensed in Europe. And they're flukes of the studies that contributed to the licensing in each country.
Gotcha.
So I know one starts off with telmisartan at BID and one starts off at SID. And so as a veterinarian, I would look at that and I would say, is this cat easy to get a BID drug into?
Yeah.
Then I might follow that route if that's what your country says, right? But if it's hard, I might say, hey, it's licensed over here at once a day. I'm going to start like that. Yeah. So it all works. It doesn't matter.
And we're almost at the end of the podcast. So let's talk about end-stage renal disease.
What do we do? Yeah. So you're stage 4 guys. Survival is like weeks.
Right. Mm-hmm. I mean, to me, it's all about quality of life. Yeah. Of course, I mean, it's important to have that discussion with the owner. What does this mean? Where are we? What does this mean in terms of survival and quality of life? Yeah. And to me, it's about maximizing quality of life and that passage to,
Do you use any quality of life scales or any of those tools?
No,
Have
I
you used
don't
any of
actually.
those? Because there's a number in the literature. Some have been devised specifically like for cancer patients, and there's a couple that are a little bit more generic. So I've been kind of interested in having owners start to use those as their cat is late to help them, because you don't see the forest for the trees. You kind of get lost in your cat's disease. So
for sure,
it'd be nice to know if they help owners in their decision-making process.
No, I think that's fantastic. And for me, once they're in that stage 4, if they're truly in stage 4, I actually back off on a lot of the treatments. Try not to treat phosphorus. I let them eat whatever they want. For sure, I try appetite stimulants and subcutaneous fluids, but it's about making that cat as better as it can be.
Right. If you've got a month or 6 weeks left, we want it to be the happiest month or 6 weeks that you can have. Yeah.
And do you do any extreme procedures here, like
you mean like dialysis,
renal transplants, etc.?
When I was in New York, obviously I trained in hemodialysis, but we only did hemodialysis in that other species in small animal that we treat chronically. In cats, we only did acute for a number of reasons. Yeah, they developed too many dialysis-related complications on chronic dialysis, and it has more to do about their blood volume. So the reality is chronic dialysis for cats is not really as feasible as it could be. So no, that's not a therapy. Transplant, I think, is there's ethical concerns because you do have to adopt the donor that has one kidney.
Who can't consent.
Who can't consent, right? And has left one kidney, So, I think there's a whole ethical discussion there.
And I think it is that the ethical discussion is even worse because we know 80% will get renal disease. So now you have
another cat
right.
that will get renal disease and with only one kidney.
And if they develop ureteral disease, they're in trouble.
Yeah.
So there's no doubt. There's a whole discussion around that. The reality is with renal transplants, cats are going to live on average of 2 to 3 years with that new kidney. So if you think about that,
Is it worth it?
Exactly. I think you really have to ask that question.
Yeah.
So in human medicine, they have now dialysis that is a lot less invasive, sub-Q implanted dialysis and that sort of things. Is there anything in animals that we know? Does it work in animals? Because I remember that a friend of a friend of a friend had acute renal disease, and now he's on this minimal invasive dialysis, and it's much better than sitting in for hours and hours and hours. He's just at home, and
Is this something that they do at home?
Yeah, so I think there's two things they can do at home now. They can either do peritoneal dialysis at home, so you actually get a peritoneal dialysis catheter implanted, and you go home with a machine. That's exactly right. That slowly does your dialysis over multiple hours. They also have units for home now to do continuous renal replacement as well as home intravenously as well once you have your graft. And they do sell units, and I know I have some colleagues who have tried it in animals. Yeah. Again, mostly the other species that we will not talk about today. I think it's just too challenging in cats, because their abdominal space is so small, they form a lot of adhesions, and they'll clog that catheter probably really quickly.
Yeah, it's a lot harder in cats.
Interesting. So.
Cats bring their own challenges, don't they, to the table?
They sure do.
Yeah.
Always do.
Yeah. Well, that's a really great review of chronic kidney disease in cats.
That's awesome.
That was fun.
Yeah.
So thank you so much.
Yes.
I think we're at the end of our 50 minutes already. It's crazy.
Oh, you guys have been
We
great.
didn't even
Thank you
talk
so
about
much.
acute kidney injury.
I know.
Next time.
You need to come back. Yeah,
you
We'll
need to
come
talk
back.
about ureteroliths.
Yeah.
I know. There's so many other stuff.
I'll definitely come back. It'd be my
Good.
pleasure.
Oh, you're wonderful. So thank you so much
Thanks,
once again.
Serge.
Thank you so much. Appreciate it.
Dr. Susan Little is a feline medicine specialist with 2 cat-only hospitals in Ottawa, Canada. She is best known as an international speaker and as the author and editor of 2 textbooks, The Cat, Clinical Medicine and Management, and August, Consultations in Feline Internal Medicine. Along with 3 cats, she also admits to owning 2 dogs, and you can follow her on social media with the handle @CatVetSusan. Dr. Jolle Kirpensteijn is a diplomat of the American and European College of Veterinary Surgeons and a big cat fan. His specialties range from surgical oncology and reconstruction to minimally invasive surgery. He is the author of 2 textbooks on basic and reconstructive surgery. Did you know he was allergic to cats? Jolle works currently at Hill's Pet Nutrition. You can follow him on social media with the handle @GVETSX. The opinions of this podcast are those by Dr. Susan Little and Dr. Jolle Kirpensteijn. Veterinary medicine is a complex profession, and often there are multiple diagnostic and therapeutic options for different disease processes. If you're a pet owner with questions, please go to your local veterinarian. If you're a veterinary professional, ask your questions on our Instagram page @Purr Podcast.